Good evening, everyone. Thank you for joining us. My name is Judy Blake, and I am a program coordinator for Family to Family Network. We are here in Houston, Texas. Tonight, we're going to be discussing making sense of the Medicaid waivers. A lot of information to cover. We're going to go ahead and jump right into it. Leslie Lawson is also with me, and she's going to be presenting as well. So, can you see the next slide, Leslie?
No, it's still on the first one.
Hold on. God, and we just did this morning. Is it still on the first one?
Yes.
So not my day. Hold on. Let me try again and share again. Share. Okay. What do you see now?
It just says, okay, now the poll. There you go.
Great. Okay. So everyone, if you could just take a quick minute, we just want to know who on this call, what kind of knowledge you do have. And it's okay if you don't know anything. And that's why you're here. That's why we are having this presentation. If you could type in the chat either a 1, a 2, a 3, or a 4. Number 2 means you've heard of them, but you don't know what they are. Number 3, you know a lot about the waivers. And number 4, if your child is or your adult is on a waiver, let us know what waiver it is. And then Leslie's going to check that in the chat box for me. So we want to disclose that Leslie nor I work for Health and Human Services Commission. We do not work for the state of Texas. We work for Family to Family Network, an amazing nonprofit. If you want to verify this information, we encourage you to go to the website listed, which is a Health and Human Services website. So just remember, special education, it prepares your loved one for further employment, further education, employment, and independent living. And basically, it's getting your loved one ready for college and a career. Really important to have a vision for your child. I've always said that no child ever rises to low expectations, and we always want to presume competence for our kids. So we know that the waivers are very confusing, which is why we are having this information presented to you. It's almost like you have special education and now you have the waivers that you need to really understand. So I don't know why the animations are not going through, Leslie.
It's not on the, it's got the sample slides on the left. It's not the big full screen right now.
Okay, hold
I don't know
on.
if that makes a difference.
Yep, it sure does. Let me see.
It says double click to enter full screen mode.
Yep,
It's not full screen mode.
yep.
I mean, it's not a big deal if it's not a big deal to you.
No, I know. Let me try one last time, and if not, we'll just go ahead with what we did before.
Oh, there's your email.
Yep, I know I'm getting rid of that. Okay, now we've got it. What do you see
You're
now?
breaking up.
What do you see now?
Now it's full screen. Yes, it's on the
Perfect.
first slide.
Wonderful. Okay, now we're in good shape. Okay, please remember, adult services, they are not guaranteed. You have to qualify for them. So unless it's something like TWC, which stands for Texas Workforce Commission, or if you have a Medicaid waiver, like one of the waivers that we're going to discuss, Nothing is guaranteed. It is so important that if you have no idea what Medicaid waivers are, that there are 2 phone numbers that you're going to call, and we will give you those phone numbers to make sure that your loved one is signed up for the waivers. But remember, there's long wait lists and you have to qualify for them. So in the world of waivers, there are so many different abbreviations or acronyms. And what's important to remember is that some of these acronyms or abbreviations, we are listing them here. If you're not sure what something means, find out, ask questions. Don't just agree to something without understanding what it means. What you're going to hear over and over again is the term LIDA, and that stands for Local Intellectual and Developmental Disability Authority. So for example, if you live in the Harris County, it's called the Harris Center for Mental Health and IDD. If you're in Fort Bend County, it's called Texana. I'm not going to go over each of these abbreviations. I'm happy to send you the recording of what we discussed so that you have it. Just know that you must be familiar with these abbreviations so that you understand what people are telling you when it comes to the waivers. So Medicaid waivers are different than Medicaid health insurance. So when we talk about Medicaid health insurance, we're talking about things like CHIP, the Children's Health Insurance Plan. Your child might have the STAR plan, the STAR Kids plan, the STAR Plus plan. And you have what we call a managed care provider or organization. That could be somebody like WellPoint, which used to be AmeriGroup. It could be United. It could be Community Health Choice. It could be Molina. It's important to remember that Medicaid is health insurance. The Medicaid waivers provide for long-term services and supports. So why do they call them waivers? Because what we do is we waive the Medicaid rules. You know, our government has a lot of rules. And when your loved one is on and receiving services from a Medicaid waiver, the government has said, you know what? We're going to strike some of those rules. We're going to waive them so that your loved one gets support. If possible, we want our loved ones to live in the community to the extent possible. The goal is to have them either in their home, in someone else's home. Maybe they're like my son and they're in a group home. Hopefully, they don't end up in nursing facilities or state-supported living centers unless this is something that they really, really need. Please note that on the left-hand side, we list a picture of a nursing facility, and on the right-hand side, we have intermediate care facilities. The abbreviation for that is ICF. And then we also have state-supported living centers. Please note that we have no affiliation with ResCare or Avondale House or Reach Unlimited. We just wanted to give you examples of those ICF facilities. So Medicaid funded programs, you have entitlement services and you have non-entitlement services. So let's look at the right-hand side first. The non-entitlement services are what we're going to be talking about, those Medicaid waiver programs. And you'll see the 5 listed there: the MDCP, HCS, CLASS, DBMD, and Texas Home Living. These provide for what we call long-term services and supports so that our loved ones don't end up in a nursing facility or in a state-supported living center. Sadly, the wait list is about 15 to 20 years long. Our Texas legislature just met. No new slots were provided for these waiver programs. So now the list might go to 22 years for all we know. On the left-hand side, you'll see entitlement services. Keep in mind that even though your loved one might be entitled to something, that doesn't mean there won't be a wait for it. There just might be less of a wait. And a good example for that would be community first choice, which we're going to talk about later in this presentation. That's because there might be a delay in getting a service coordinator. There might be a delay in your managed care organization reaching out to you. But when something is an entitlement program, that is something that you should be receiving in a timely fashion. So what we have next here, and I want you to take a look at the bottom, is the link to the Health and Human Services website, because remember, Leslie and I do not work for Health and Human Services. And this is a comparison of the different waiver programs. And you'll see we have HCBS, we have the Yes Waiver programs, we have MDCP class. And what it does is it explains to you what is included in that program. And this is just part of it. If you go to the link at the bottom of the page, you'll see a document that is a number of pages long, and it explains what is included in each of those waiver programs. Each family has to make their own decision as to what waiver program they think is best for their loved one. For me, HCS was a better program and a more appropriate fit for my adult son. For Leslie, the class program worked better for her son. So every family has to choose. While you can consult other people and you can check with other families, and we encourage people to do that, you need to educate yourself so that you can make that informed decision. The next slide, and we apologize that it's from 2018. Unfortunately, that was the latest version that we could find something for, but it gives you more information about the different programs and what ages does it serve. So for example, this is through the Texas Medicaid plan, and you'll see here that for Community First Choice, it's for all ages. If someone needed an intermediate care facility, all ages. What's important to know is you see that link at the bottom of the page, and that will give you more information. We have a lot to go through. That's why we can only breeze through some of these slides. The first three that we're going to talk about, the MDCP, Star Kids, and the MDCP provides support to families for caring for children under age 21. They must be medically dependent, and it's to encourage deinstitutionalization, meaning we don't want the child to be institutionalized, and we want them to not be in a nursing facility. Used to be a lot easier to get the MDCP waiver. Now it can be a little bit more challenging, but it can take, I've been told, anywhere up from 6 months to about 2 years to get on MDCP. It just depends. The next waiver is the deaf, blind, multiple disabilities waiver. That provides home and community-based services to someone who is deaf and blind with multiple disabilities. And the reason that we have this waiver is because it's a lot more cost effective, and we want the person to stay in home with their family. We don't want them to be placed in an institution. But keep in mind, it's not deaf or blind, but deaf and blind with multiple disabilities. The next waiver program is called CLASS, and this provides community-based services to people where the primary diagnosis is of a related condition. So what that means is it could be autism, it could be Down syndrome, it could be cerebral palsy, and that person is receiving those community supports in the home so that they don't have to go to an intermediate care facility. It's important to note that a person who's on the class waiver must also have moderate to extreme deficits or delays, if you will, in those adaptive behaviors. And what we're talking about when we mention adaptive behaviors is those activities of daily living, bathing, feeding yourself, dressing, safety issues, things that allow someone to manage their daily life. So for class, the primary diagnosis must be that related condition, and they must have moderate to extreme deficits in those activities of daily living. What you want to do if you are on this call and you have a loved one who has either autism, Down syndrome, a chromosomal disability, cerebral palsy, and they have a lot of challenges with those adaptive behaviors. If they are not on the wait list, the interest list, please call that 877 number at the bottom of your screen tomorrow. Make sure that you do that. If there's one thing that you gather from this presentation, please call. If you don't get a live person and you have to leave a message, please call them back. Make sure that you get your loved one signed up because the wait list is so long. So we also have the Star Plus Home and Community-Based Services Waiver. That's for individuals with disabilities or those who are elderly over age 65. And in this case, it's the managed care organization that's going to provide that acute care and those long-term services. So keep in mind that you can only be on one waiver at a time. So if your loved one's name comes up for either class or MDCP or Texas Home Living, then you wouldn't have the Star Plus waiver. My son had the Star Plus waiver from when he was probably all through his 20s until his name finally came up for the HCS waiver. What I did is I worked with my managed care provider, which at the time was AmeriGroup. Now it's called WellPoint. And I worked with what I call the local authority to arrange for services. So keep in mind that the Star Plus services are managed by the managed care organization, and they have their benefits as well. And there's a phone number for you to call.
So I'd like to say too that the Star Plus Home and Community-Based Services waiver is the one children roll into if they have MDCP and haven't come up on another
Great.
waiver list, because it's for people who have more medical needs and need nursing care. But somebody that's doesn't have a waiver yet, if they're 21, they can get that. Some people can meet the qualifications for that, even if they don't have certain nursing care needs. I know some people that have autism and some extreme behaviors that get it, but and it's not necessarily the best waiver, but it's better than not having any waiver at all until you come up on one of the other waivers. And for class, you can have a wide variety of disabilities. So for instance, my friend's son, he had class waiver. He had cerebral palsy and needed a lot of help with activities of daily living, dressing, bathing, things like that. But he went to Yale for college. So I know another lady that is a teacher and she has class because she wouldn't be able to get to her job if she didn't have the supports for her physical disability to be able to get up, get ready, go to work. My son has autism and an intellectual disability, and he's on the class waiver. The biggest difference between class and HCS is class isn't going to have any residential component like host home or group home. And class also has a wide variety of specialized therapies like recreational therapy, horseback riding therapy, massage therapy, a whole music therapy. So you may be on one waiver, come up on another waiver later and compare and decide to switch, or you may stay on the same waiver that you're on.
I'm so glad you brought that up. Yeah, it's really important because everyone might want something a little different. For me, all of those therapies, it's not my son's thing. With my son, it was really important that he moved to a group home because I'm a single parent and it's a little bit different for me. I mean, all of us need to have a plan, whether or not you're a single parent. But for me, it was more important to do that rather than the therapies. So Ryan is on the HCS waiver and he is in a group home. So we mentioned the local authority and we've listed some of the authorities on those on this slide. If you're on this call and say you're in West Texas or East Texas, you'll see we have a link at the bottom of the slide where you can locate your local authority. Really important that you are familiar with them, that you know them, and you know what services they can offer. Because even if your child or young adult, maybe they're 5, 10 years down the road on their name coming up on on the waiver list, there might be other services you can get from your local authority. Maybe you can get respite services. Maybe there are some other programs that you can partake in for your loved one. Every local authority has different choices, and it is usually a cost sharing program. When the child is under 18, once the child becomes an adult, then parents' income is not going to be taken into account. But if you're on this call and you have maybe an 8-year-old and you contact your local authority to see what services they have, they are going to take the parents' income into account and they will let you know what the family copay is. So after this slide, I'm going to have Leslie take over. The three paths to eligibility for the HCS waiver, the Texas Home Living waiver, or Community First Choice is an intellectual disability if your loved one only has that of 69 or below. And when we say 69, boy golly, they mean 69, not 70. In this case, 1 point really does make a difference. Your loved one may also have autism spectrum disorder. And if they do, their IQ could be 75 or below. Or they could have a related condition, cerebral palsy, chromosomal disorder, Down syndrome, and an intellectual disability. And then their IQ would be 75 or below. So you have to look at it in 3 different ways. If you have a child who only has an intellectual disability, their IQ, their full scale IQ must be 69 or below. If they have autism, then their IQ must be 75 or below. If they have autism and their IQ is 76, they probably would not qualify. If they have a genetic disorder, a chromosomal disorder, and their IQ is 69, sure, they probably would qualify. But if their IQ is 76, they probably wouldn't. You have to confirm all of this with your local authority. Again, if the person has that related condition, they're looking at those adaptive behaviors. It's possible they could qualify. You just have to confirm with your local authority. So a related condition, we don't want to spend a lot of time on this because we want to go more in depth on the waivers, but keep in mind those related conditions, epilepsy, cerebral palsy. These related conditions, they must have manifested themselves before the person reaches 22 years of age. And that can be really challenging sometimes. I know somebody who had a traumatic brain injury at 25 years old and they didn't qualify for certain things. And why was that? Because it didn't happen before 22 years of age. A related condition is something that is severe, it's chronic, it affects learning, mobility, their capacity for independent living. Again, you'll need to check with your local authority to see whether or not your loved one would qualify. Leslie, you want to talk about this, or do you want me to do that last one?
Go ahead. Go ahead, Judy.
Okay. So under the determination of intellectual disability, remember I mentioned that our LIDAs, they love their abbreviations. So a lot of times they'll say, oh, was a did done, which sounds grammatically incorrect. But what they're referring to is that determination of intellectual disability. So if you recall when I mentioned on the previous slides, the 69 or below, or the 75 or below, that's what they are referring to. That determination of intellectual disability, it must have been completed in the last 5 years. I realize it sounds kind of crazy that if you have a child who is, 13 and maybe they had an IQ of, 46 and they have trouble, they're not able to read, they can only spell their name, you might be thinking, really? Why do you really have to have that determined again? Those are the rules. So it must be within the last 5 years. And what they'll do is they'll do this determination of intellectual disability, and they will let you know if that person qualifies. They will let you know within 30 days of the assessment. So I know sometimes parents have said, well, gosh, we were my son was assessed, 3 months ago and we never heard anything. I would follow up on that. Maybe they don't have the right contact information for you. I'm not sure what happened, but the local authority is responsible for letting you know the results within 30 days. Yes, the results can be appealed, but it must be within the last 5 years in order for you to be considered for one of the waivers that their name has come to the top of the list for.
So
So,
when you get when your name comes to the top of a waiver, of the waiver list, whichever one it is, they're going to do assessments for that. So when you call, you don't have to prove anything to get on the list or anything like that. Just give them your information. Make sure if you move or change your phone number, you let them know, because if you don't respond when they call to ask you if you still want to be on the interest list, they'll take you off the interest list, and you don't want that to happen. For HCS, after they do the determination of intellectual disability, they're going to do other assessments, and one is called the level of need. And the level of need is really important. Of course, they didn't put it in the right number order, which makes it very confusing for parents. But your level of need helps determine pay rates for different services. So it's really important for you to know what your child's level of need is, because that's going to help you pick an agency, because some agencies pay the full rate for things and some don't. Class does not have a level of need assigned. It's more about just based on need, and they do their assessments a little bit different. Next slide.
sure. And Angela, you had written in the chat box when looking at the waivers, Do they do an annual evaluation to see if there is a change? Will they continue to check IQ? So once they do that determination of intellectual disability, it's not like they're going to be checking again. Once you're in, you're in.
Yeah, they'll do, so you'll have a yearly budget meeting
Mhm.
and, I can't remember how often, and it's probably different. My son's on class, Judy's is on HCS. They may go through the list. They'll ask you what's changed. Like a lot of times when we do ours and it's time to do an update, they just ask if anything's changed. They may go over a few things. A nurse comes in once a year if you're on class and goes, sees your loved one. So, but it's not like they're going to keep doing IQ test or anything like that. Like Judy said, once you're in, you're pretty much in. Now, services can change. You know, people grow and start doing more things on their own, so that number of hours can change. Sometimes people have a change in level of need, maybe due to severe behaviors or regression, but you have to document to get that changed, which can be kind of difficult. But it's not like they're going to do a new determination of intellectual disability or anything like that. This page shows another page that's on that waiver comparison chart that Judy showed earlier. I like this because it tells you, it'll have a list of all the different waiver services. This is only a snapshot and tells you what services are available on each waiver. And then even if you scroll further down on this comparison chart, it'll give you a definition of each service, which is very helpful because we don't know what it means for cognitive rehabilitation therapy. I don't, you may not know what that term is or what actually is community living support. So it gives you definitions. And I really love this waiver comparison chart because it's very helpful in understanding, especially if you have, if you're on a waiver and then your child comes up on a different waiver. So my son got offered class when he was a teenager. Of course, you want to take whatever waiver you come up on first, um, because it's going to be better than not having anything. So take whatever waiver comes up first. And then if they come up on another waiver, do a really good comparison, talk to other parents, either through Facebook groups or networking about what their experience has been on each waiver. Like for my son, a group home placement really isn't going to be appropriate for him because he can't tell me if somebody's mistreating him, neglecting him, or abusing him. So I wouldn't want him in a group home. So we have a different plan for his future when we're no longer here. But you have to think about all of those things. And we did use a lot of the specialized therapies. He did horseback riding therapy, he did massage therapy, he continues to do recreational fit therapy. So it really just depends. But I had to really look hard when he came up on HCS at the time. So HCS has recently had a change. So before COVID, you could not live in the same home and be the caregiver for the CFC PASHAB hours. The only way you could get paid as a parent that lives in the same home was to do host home. If you do host home, you don't get respite care. And so when I weighed that out, it was much better for us to stay on class. Well, since COVID, they had an exception to the rule during COVID, and now they've made that permanent. Now, you can't provide respite for yourself, but you can be the caregiver and keep your respite hours and hire somebody to do the respite hours and get paid an hourly wage, or you can do the host home, um, where you get paid a daily rate based on level of need to care for them. And you could also use that money to help pay for respite if you wanted to, or you could choose a group home like Judy's son chose a group home. You may live in a host home with someone that's not your family. So there's a lot of different residential options on HCS. And you can, if you have guardianship on class and HCS now, you can work for the provider agency, even if you have guardianship and live in the same home, and be a paid caregiver that way also. Because host home is not an hourly wage. It's like a stipend for them living with you. So it's, you do have a lot of residential options on HCS that you don't have on class. If you click on these links, you know, it's going to give you a lot of really good information. And this is where, Judy, I don't know if you want to do it now, where we,
Do it at the end, I
okay,
think.
we'll do it
Yeah.
at the end. We want to show you how to access all the rate sheets. Um, that way you can know if an agency is giving you the correct rate. Some agencies pay the full rate, for instance, for host home, some don't. And so you might want to choose an agency that does give you the full rate. But the other thing about the rate sheet is it also lists all the different services available on the waiver. And it's good to know how to access them, because if you just had the link and the rates change, you're going to have old rates. So we want you to know how to access the rate sheets. All right, next slide. So the first thing you have to do when you come to the top of the waiver list is they're going to ask you to pick an agency. On HCS, in Texas Home Living, they call it a provider agency. On class, they call it a direct service agency. And then also, if you want to do something called consumer directed services, where you're the employer, you would also choose a financial management agency to do your payroll and taxes. But if you do consumer directed services, that is a good way to pay a higher rate if you're not going to be the caregiver yourself. If you have somebody in the mind to be the caregiver, the rates are going to be much higher on consumer directed services. So on the rate sheets, you want to pay attention to that. On the waivers, you can't do all services under consumer directed services, but you can do several of them. Also, in some cases, you can split between. So like we were doing consumer directed services because I had a caregiver that helped us with Cameron, but when COVID hit, nobody was coming. So I switched to the direct service agency for the pass have attendant care, the CFC part that's paid for by the federal government, and became his paid caregiver because nobody else was coming in. So I might as well get paid for it because I was doing all the caregiving, but I left my respite care on the consumer directed side. And the reason I did that was because it would pay, I could pay my respite care provider a little more on that side. And it's not like the provider agencies have a lot of people working for them because it's hard to find caregivers at the low rates. And so even if you went with the direct service agency side, you might still have to find your own caregivers, but it's not for everybody. Your financial management agency trains you how to do things on the consumer directed side, but you're the employer. You find your own people, you train them how you want them to be trained, you hire them, fire them, make sure they have their timesheets or their clock-ins done correctly, and then you have the financial management agency that does all your payroll and taxes. So it does take a little bit more time. So some people don't want to do that, and that's definitely understandable.
It is more work. I mean, I did it when my son had community first choice services because I wanted to be able to hire the people I wanted, to let them go, to arrange the hours. And then I submitted timesheets and they then paid the caregiver. So it is more work, but it allowed me to make my own choices. It was a lot easier to do that for me.
Yeah, and it does allow you to pay a little more. So go back just a minute, Judy. I
Oh,
wanted
I'm
to
sorry.
mention something on that last slide.
Yep.
Um, So if you're the legal guardian, you cannot be the paid caregiver under CDS. If the parent does not have legal guardianship, they can be the paid caregiver under CDS if the person with the disability meets the qualifications to serve as the employer and is able to manage the employer responsibilities, or if the person with the disability, if you have someone outside of the home that can serve as the legally authorized representative to help them with that, because you can't be the employer and the employee. So I just wanted to mention that. But you can work for the direct service agency side or the provider agency and get paid. You're just like any other employee that they would have. So there's lots of options. They don't always tell you all of this. So it's really important to dig deep on all the different possibilities. Okay, Judy.
Thanks. Whoops.
And this is just a little more information and a link to learn more about consumer directed services and what services can be done through CDS and which ones can't. And then we pretty much covered that last paragraph. Another thing we wanted to mention is if you or your spouse or the parents have private insurance, like through their employer, a lot of times the person with the disability can stay on your private health insurance. In Texas, it's past age 26. You might have to get a letter from the doctor, but be sure and check that out with health and with your company's
HR.
HR department, and you might have to get a letter or show them something. But we were able to keep Cameron on my husband's insurance until he retired.
And what's really nice about that is that you have the private insurance, because we did the same thing. And then my son had Medicaid, so that picked up all of the copays. So it was really nice, and it at least allowed us to continue going to a wider array of doctors that the private insurance accepted.
Right. Now, if you go to a doctor that only accepts your private insurance, Medicaid's not going to pay. So they have to accept both. But something we didn't mention in the session earlier today, if you do have your loved one on the private insurance, you definitely want to check into the HIP, HIPP, the Health Insurance Premium Program. Sometimes it's so beneficial for you to keep your child or adult on your health insurance that sometimes the state will pay your premiums for you. And there's a website called Get Hip, I think, or if you put in health insurance premium program, or if you need help finding that, just let me know, because that has been helpful to a lot of families. This is just a map of the managed care service areas. So if you're in certain areas, you get to pick from different MCOs, managed care organizations, based on your area. So for instance, Harris County, your choices for Star Plus, which is the adult Medicaid for people with disabilities, is Community Health Choice, Molina, and United. And you can go on their website, you can have your service coordinator from your MCO tell you, recommend doctors that supposedly accept their plan, but really you should talk to your own doctors. I know when Cameron first got on it, I spent 2 days trying to find a primary care physician that took that insurance. And most of them listed on the website and on the list that my service coordinator either weren't taking any new Medicaid patients, or were no longer accepting anybody, or weren't doing it at all. So check with your doctor, because that might help you decide on which managed care organization to choose to run your Medicaid health insurance through. This is for the health insurance part. Okay. So if anybody has any specific questions about their waiver, be sure and type them in the chat box. But we also wanted to talk about, so a lot of people are on the waiting list for the Medicaid waivers and they don't have a waiver yet. So what can you do while you're waiting? Well, due to the Affordable Care Act, there is now non-waiver CFC. That's the PASS, Personal Assistance Services and Habilitation Attendant Care that the federal government pays for. It's part of every waiver, but now they have non-waiver CFC. So let's say your child turns 18, they don't have a waiver yet. They qualify for SSI, which then qualifies them for Medicaid health insurance. You would go through your MCO to get the community first choice attendant care pass hab hours. So at least you would have that part. You wouldn't have all the other waiver services, but you'd still have this while you waited. And then we've just kind of listed, the qualifications for that. A lot of times that's very helpful, especially if your loved one has aged out of public school and you want them to go to a day program, and that's not free. So the parent can work the hours and then turn around and use that money to pay for day hab or pay for a therapy or whatever. Or some people have to live on that money. It's their job. And the good thing is there is something called a difficulty of care in IRS income tax waiver, where if you live in the same home and provide care, you don't have to pay federal income tax. If anybody wants to know more about that, please reach out and I'll send you that information. So
And community first choice is really just a Band-Aid, but at
yes.
least it is something. And it's important that people have it. I think that what it was intended for and what it has actually turned out to be are two different things, but it is something.
Yeah, they'll do an assessment and determine the number of hours you get. So you want to be brutally honest about everything that your loved one, you have to, anything that you have to remind them to do, help them do, or do for them in the areas of activities of daily living. And like if you have to help them get dressed or shave or bathe or cook their food or be right there while they're eating, whatever it is, you want to let them know all the help they need. Like, oh, does your daughter brush their teeth? And you say yes. Well, does she really do it independently? Do you have to be in there? How much time do you spend doing that? I mean, they do a really detailed assessment to help determine the number of hours that you get. So you don't want to make them sound like they can do more on their own than they really can, because that'll affect the number of hours you get. And habilitation is part of that, and that's which to me, personal assistant services and HAB are kind of one and the same. I mean, of course, there's some things that my son's never going to do on his own, but I'm always trying to teach him to be more independent. So that's kind of the habilitation part. And there's activities of daily living, which is basic everyday activities. And then there's IADLS. I'm losing that, what that stands for, Judy, but maybe you
Oh,
can.
instrumental activities of daily
Yeah,
living.
and that's kind of the definition for that, activities related to living independently in the community, meal planning, preparation,
And
find.
those are the kinds of things that my son needed a lot of help in. He could do
Yes.
the bathing and the grooming and the dressing. Wasn't the greatest dressing that he did, but it was dressing. And but he had a lot of trouble with the meal planning, the meal prep. Um, Managing finances is just not his thing. He's good, he's pretty good now, but it's just challenging. And participating in the community is really what my son needed a lot of help in. So it's different for each child.
And they may need a lot of help in both things, like my
Right.
son. So talking about getting CFC going, what really should happen is when your loved one gets SSI and Medicaid and you choose a managed care organization, you're going to be assigned a service coordinator through your MCO, and they should reach out to you and ask you, you know, does your loved one need these services? But we don't see that happening. Uh, most of the time, so you need to ask for that. So if your child has Medicaid, whether they're a child or an adult, and they have a managed care organization and a service coordinator through that managed care organization, you can contact them and request um, CFC Pass Hab, and they'll get the ball rolling, and then they'll contact the LITA, like Texana or the Harris Center, or whichever one is in your area. They'll do the level of care assessment, and then it goes to the state to be reviewed and approved, and then you'll get set up like on that too. And of course, for that, you'll also have to pick a provider agency, and you could do CDS if you want, or you can just do agency, whatever. But that's how you get started. If a lot of time, there's a lot of turnover of service coordinators, and so you may have, if they don't know what you're talking about, ask to speak
Yes.
to a supervisor,
It's
and
really,
if,
really important.
yeah,
And it's hard because until we pay people better wages, um, they can make more money elsewhere. So it could take several months to
yeah.
get a service coordinator through your local authority.
Yeah, and if you are just hitting a brick wall with your managed care organization, contact your LITA because they can intervene and get the ball rolling. Because sometimes it's just a lack of communication between the MCO and the LITA.
So these last couple of slides are simply resources. And again, if there's two things, please contact this phone number to add your loved one at a minimum to these waivers. I mean, obviously, if they're not deaf and blind and have multiple disabilities, you wouldn't want to add your loved one there. If they have an intellectual disability, you're not going to add them to MDCP, but definitely to the class waiver. And then you want to make sure that you contact your local authority to add their names for the HCS and the Texas Home Living waivers. Really, really important. And change happens because we demand it. And with the last legislative session, there were a lot of things that didn't happen that really should have happened. And that impacts all of us. When Leslie was talking about the rates, and we're going to go over that next, somebody can make more working at Buc-ee's with health benefits and a vacation plan than they can taking care of our loved ones. And I love Buc-ee's. Buc-ee's is great, but taking care of our loved ones, people should be compensated more for that. So these last two slides are simply HHS resources and websites for y'all to access. And that gives you more detailed information on the waivers and the community first choice. If you could, please make sure that you scan the QR code, or I'm going to go ahead and type in, whoops. Here we go. Let me copy and paste that. Oh, where did my chat box go? There we go. Okay, I just entered the link if you want to copy and paste it.
And just to be clear, you can be on multiple wait lists at the same time. You can only be on one waiver at a time. And you could either, like, let's say your child is on HCS and they come up on class. Usually it happens the other way around. You can have the whole assessment done before you decide which one to to choose too. So they might not tell you that. It's just like everything, the more you know, the more you get. I talk to a lot of people and they're only using a fraction of their waiver services. I mean, not that you're going to use all of them, but some people, like I didn't know for a few years that we could put dental services on the budget for Cameron. And, Medicaid does not have dental services. I mean, you get a little bit of dental services through your MCO, but it's not a full-blown dental plan. So we always put dental in adaptive aids on class. Um, Everything's called something different on the waivers, like for day programs, they don't really call them day programs anymore, but that's still what they are. But for HCS, they call it ISS. Under class, it's called pre-vocational. So the more you know, the more you look at the rate sheets, the more you look at the waiver comparisons, the more you can ask questions and you may find out, oh, I didn't know that service was available, because they may not tell you every single thing. It's going to be up to you to, look into all of that and talk to other parents. Other parents are going to be a great resource
So
too.
when you're looking at uh the survey and it says, this will help me in my child's IEP, that's because generally we are talking about uh, IEPs and ARD meetings and the basics of special education and things. So we had to keep the survey very general. So if you could just rate it, hoping that you learned something today, that's all that we're looking for. But we realize that it says, oh, this is going to help me at my next ARD meeting. If you could just, in your mind, this information will help me with my loved one, that would be great. Can you see my screen now, the F2FN screen?
Yes.
Great.
And it's
Okay.
all about planning for the future.
Yep.
Medicaid waivers are part of planning for the future, just like the IEP and the transition services that are in school. So we just really wanted to cover waivers because we talked to so many people whose kids are older and they've never put their child on the interest list. And, they need those services because now their child is an adult, and
And the
parents are
parents are
getting
aging.
older.
We're all aging.
Yep.
Makes a big difference. So we're going to talk about the rates. And we know that we went over by a few minutes. Several of you have asked for the slide deck, the recordings. So I've made note of that. Give me until tomorrow. If for some reason you don't get it by tomorrow night, please email me. I'm the one who sends out the email reminders, or call our office, whatever's easiest for you. And uh, if for some reason you don't get it and it gets lost in cyberspace or something, but I have made note of everybody who wanted the recording or slides. So Leslie is like the queen of knowledge, and it's really important. What she wants to talk about is showing you the rate sheets. And this is our website, and it's f2fn.org. And what you're going to want to do is go to the Getting Started tab, and then you're going to scroll down to Resources. And then what have we been talking about? Medicaid and long-term services. So you're going to click on that. And then you're going to see here, rates paid for each waiver. Again, we love our Health and Human Services websites. See on the left-hand side? So which one would you like me to pick, Miss Leslie?
Well, somebody has HCS, so maybe we'll pick HCS.
I can do that.
I
Where did
think they're
it
alphabetical.
go? Yep, there we go. So there's HCS. And then what you can do is see the payment rates. So I know that's kind of tiny. I wish I could make it bigger, but I'm not able to, unfortunately, because I'm
Yeah,
not
and
that
it's
smart.
several pages with all the different services, but the big one at the top, Judy,
Mhm.
the first one is host home, which a lot of parents do on HCS, and you'll see that the rates are determined by the level of need. But it's good to know what your rate is. So there's gonna be, I'm sorry, I can't, let me blow mine. I can't blow mine up. It's going to be your rate, but there's other rates that go to the agency. But it's good to know that because when you talk to your different provider agencies, you can see if they're paying you the full rate or if they're taking a cut of that because they're already getting a cut that's listed on the rate sheet. Um, so you want to make sure you're, I mean, that's not totally the most important, but a good, most of the really good provider agencies do pay the full rate for host home for level of need. Um, so that's just something I like to point out. And the same for the hourly rates that you can pay people. Sometimes they make you think that they can only pay a certain amount, and there may be a little room. These are the ceilings. They can't pay any more than what's on here because this is the state. But it's good to know that.
Questions? Any other questions y'all have? We know that it's a lot of information. So I will make sure that I send you the slides, the recordings for whoever asked. Please make sure that you complete the survey link. That will help us a lot. We want to make sure that we are giving information that will help everyone and and that is that accurate information. So let me go ahead and copy it again and paste it at the very end. So that can be the last thing that you see.
And please reach out to any of us here at Family to Family if you ever have any specific questions. And just because somebody tells you something, it doesn't always mean that it's true. So if something doesn't sound right, reach out to somebody like Family to Family, or there's so many different
There's so many
nonprofits.
great agencies out there.
You can even email. I have the emails for HCS policy. I've emailed them with questions, specific questions, class policy, and that's a state email, and they're very good. It may take them a few days, but they'll give you a very exact answer for any questions if you're getting various different answers to your question. You can find out what the real deal is.
Thank you all so much for joining us. We really appreciate it. Have a great rest of the evening.